Follicular lymphoma. What does prognosis mean? Imagine being diagnosed with a condition that might stay with you for many years but can often be managed effectively. That's what understanding the prognosis of follicular lymphoma is all about. In simple terms, prognosis refers to what doctors expect about how the disease will progress and what the outcome might be. It includes factors like how long someone might live with the disease, how it might spread, and how well treatments could work. This helps both patients and healthcare providers plan the best approach for managing the illness. Follicular lymphoma is a slow-growing type of non-Hodgkin lymphoma. Because it grows gradually, many people live with it for years, often experiencing periods where the disease is inactive, called remission, and times when it comes back, called relapse. While it is not currently considered curable, many patients live for a long time, sometimes over 20 years, especially with proper care. The overall outlook is generally positive compared to more aggressive lymphomas, but it can vary depending on individual circumstances. One of the main factors influencing prognosis is the stage of the disease at diagnosis. Early stages, where the lymphoma is limited to one or two lymph node areas, tend to have better outcomes. For example, people diagnosed at stage 1 or to often have a higher chance of survival, with about 97% living at least 5 years after diagnosis. In contrast, more advanced stages, where the lymphoma has spread to multiple lymph nodes or organs like the bone marrow or liver, may have slightly lower survival rates, but many still do well over time. Doctors also use specific tools like the Follicular Lymphoma International Prognostic Index to estimate risk. This index considers factors such as age over 60, low hemoglobin levels, involvement of the bone marrow, large lymph nodes, and elevated levels of certain proteins in the blood. If a person has no risk factors, their chances of living longer without disease progression are better. Conversely, having multiple risk factors can mean a higher chance of the disease coming back sooner. Because follicular lymphoma often behaves like a relapsing remitting illness, it can respond well to treatments that reduce symptoms and control the disease. However, since it is not considered curable at present, ongoing monitoring is essential. Treatments aim to improve quality of life and extend survival, and some patients may need repeated therapies over the years. It's important to remember that each person's prognosis is unique. Age, overall health, how aggressive the lymphoma appears under the microscope, and how well the disease responds to treatment all influence individual outcomes. Medical professionals use personalized assessments to give the most accurate outlook for each patient. In summary, understanding prognosis in follicular lymphoma means knowing what to expect in terms of disease course, survival chances, and treatment results. While many live with the disease for years, the outlook varies widely. Advances in treatment have improved quality of life and longevity, but individual factors play a crucial role. Always consult healthcare providers for personalized advice, as they can interpret these factors in the context of your specific health situation.